ADHD also suffer from bipolar disorder, a serious mental illness characterized by depressive and manic episodes. Since both conditions share symptoms, but ADHD is more common, bipolar disorder is often misdiagnosed. Use this guide from clinical instructor at Harvard Medical School, Roberto Olivardia, Ph.D., to tell the symptoms of ADHD versus bipolar apart. ADHD's high rates of comorbidity with other neurobiological disorders are well researched and documented. The majority of people with attention deficit disorder (ADHD) or AD also have another condition or learning disability. Yet accurate diagnosis rates for co-occurring or standalone conditions like obsessive-compulsive disorder, anxiety, and even autism remain discouraging at best. The rates of misdiagnosis and delayed diagnosis are particularly high among patients with bipolar symptoms. They are astronomical for patients with bipolar disorder plus ADHD. What is causing my racing thoughts? Bipolar disorder and ADHD. Approximately 60 to 70% of people with bipolar disorder also have ADHD. What's more, 20% of people with ADHD have bipolar disorder. This comorbidity rate is significant enough to justify dual evaluations for virtually every patient. A physician should virtually never assess for one condition in isolation, as ADHD and OCD rarely walk alone. Yet holistic neurobiological assessments are not happening. 70% of bipolar patients are misdiagnosed at least once. On average, patients with bipolar disorder wait a whopping 17 years before receiving an accurate diagnosis. That's 17 years of mistreatment opportunities, of poor symptom management, and of patient stress and anxiety. And it's simply unacceptable, if not at least somewhat understandable. Why is bipolar disorder misdiagnosed with such regularity? Several depressive and manic symptoms of bipolar disorder and ADHD symptoms resemble each other in both children and adults. ADHD is far more common than bipolar disorder. Up to 11% of all children in the U.S. have symptoms of ADHD. Roughly 60% of those children grow up to become adults with ADHD. Bipolar disorder, in contrast, impacts just 2.6% of the population. As such, physicians are more likely to recognize and screen for ADHD. Once considered an adult condition, bipolar disorder does begin in childhood, but its symptoms are difficult to diagnose because they so closely mimic other childhood-onset conditions like ADHD, and because they are often dismissed as signs of puberty. Self-test bipolar disorder in adults. Whatever the reasons, undiagnosed and/or untreated bipolar disorder can have deadly consequences. 1 in 5 people with the condition will commit suicide. Studies show that at least 1 in THRE1, or even 1 in TWO2 will attempt it, that is 15 times greater than the suicide rate in the general population. Suicide occurs often during manic phases, when patients are more impulsive and fearful of falling into another depressive cycle. People with bipolar disorder have a reduced life expectancy of about 10 years. Among undiagnosed and untreated bipolar patients, the rates of suicide, as well as alcohol and drug abuse, unprotected sex, and other risky behaviors, is substantially higher. To stop this national health crisis, we must first better understand bipolar disorder and how it manifests in different settings at different ages in both its manic and depressive forms. We must also understand how it mimics and overlaps with other neurobiological conditions and what treatment options exist for patients who suffer from bipolar alone or in combination with a disorder like ADHD. The biggest obstacle to a good prognosis is an adequate diagnosis. Once you have an adequate diagnosis that is appropriate and you get the right interventions, you can live a wonderful, healthy, thriving life with bipolar disorder or bipolar disorder and ADHD. What is bipolar disorder? Bipolar disorder is a serious mental illness that is characterized by extreme mood swings, abrupt changes in energy levels, and distorted decision-making. In most cases, it develops in the late teens or early adulthood, though more and more experts now accept the existence of pediatric bipolar disorder, and it is estimated to affect about 5.7 million Americans. Bipolar disorder affects men and women at virtually equal rates, and the disorder is found among patients of all races, social classes, and ethnic groups. Self-test: does my child have bipolar disorder? Bipolar disorder is characterized by high, euphoric, or irritable periods called mania and low periods of depression. The mania stage is sometimes mistaken for hyperactivity, and the low states manifest themselves as inattention and lack of motivation, which are common in individuals with ADHD. Depressive symptoms of bipolar disorder. The depressive symptoms of bipolar disorder include very low mood state, a loss of interest in things that previously gave pleasure, dysregulation of appetite, either increase or decrease. Significant weight loss or gain, change in sleeping habits, sleeping much more than normal or sleeping too little. Altered physical agitation rate, slowing down or becoming more anxious. Feelings of fatigue, worthlessness, or inappropriate guilt, difficulty concentrating, recurrent thoughts of death or suicide. How depressive symptoms resemble ADHD. The ADHD brain produces an insufficient amount of dopamine, the neurotransmitter that helps control the brain's reward and pleasure centers. As such, it naturally craves more dopamine, which sugar and carbohydrates deliver in spades. Feeding these cravings may result in the appetite changes, weight gain, and sleep problems described above. In addition, people with ADHD report frequent sleep disturbances and problems falling asleep due to a racing brain. Inattentiveness and difficulty concentrating may cause fatigue, especially among students and full-time employees working long days. Distractibility and poor focus can cause people with ADHD to quickly lose interest in activities or objects that once gave them pleasure as well. The principal difference is that ADHD symptoms are contextual and situational, whereas bipolar symptoms are not triggered by any external factors. In a stimulating and positive environment, people with ADHD remain in a good internal state. If the environment is not stimulating enough, they can become bored or agitated. People with ADHD always experience life in this manner. Their sensibility and orientation toward the world is the same, even when they move through mood states of different intensities. Patients with ADHD can more often control their feelings by changing their environment and stimuli. Depressive bipolar symptoms, on the other hand, can feel like a dark cloud emerging from an internal emotional state. No situational reasons trigger these feelings of depression. Patients just wake up feeling fundamentally different when depressed and not depressed. Manic symptoms of bipolar disorder. Mania is a severe change in mood during which a person with bipolar disorder is either extremely irritable or overly silly elated. Manic symptoms include overly inflated self-esteem, grandiosity, increased, revved-up energy, decreased need for sleep for up to a week without feeling tired, extreme random distractibility, racing thoughts, increased monetary spending, extreme irritability, inability to settle down, talking too much or too fast, changing topics quickly, unusual hypersexuality, increased goal-directed activity, disregard of risk, excessive involvement in risky behaviors or illegal activities. How manic symptoms resemble ADHD. One hallmark byproduct of ADHD is hyperfocus, or the ability to focus intently on something of great personal interest for an extended period of time, at times mentally drowning out the world around. This may happen on deadline pressure or when wrapped up in a compelling project, book, or video game. Hyperfocus may cause a decreased need for sleep and may look like increased goal-directed activity. However, this is short-lived in people with ADHD, who often feel exhausted once the hyperfocus fades. A manic episode, on the other hand, is independent of external circumstances. People with bipolar disorder often want to go to sleep or relax, but describe feeling as if there is electricity going through their bodies that they cannot stop or dampen, no matter how desperate they are for sleep. This inability to settle the mind and body can go on for a week. Going without sleep for long periods of time can trigger psychotic episodes or hallucinations. People with ADHD often interrupt or talk too much without noticing because they miss social cues or because they lose focus on the threads of a conversation. Patients experiencing a manic bipolar episode are often aware they are changing topics quickly and sometimes randomly, but they feel powerless to stop or understand their quickly moving thoughts. This type of behavior is uncharacteristic and does not reflect how they would typically converse. People with ADHD report racing thoughts, which they can grasp and appreciate, but can't necessarily express or record quickly enough. With mania, the patient's racing thoughts flash by like a flock of birds, overtaking them so fast that their color and type is impossible to discern. These distracting and disconcerting racing thoughts are often mistaken for ADHD, though they are quite different in nature. During a manic episode, a patient can engage in risky sexual or illegal behavior. They may also become incredibly productive for a few days before exhaustion causes them to physically and mentally crash. Bipolar II hypomanic symptoms. Bipolar II affects 1 to 2% of the population, and its symptoms include hypomanic episodes marked by anxiety, rejection sensitivity, personality disorders, significant risk of suicide. The hypomania experienced by people with bipolar II is less intense than other manic episodes and is easily mistaken for anxiety. During these episodes, patients feel revved up or like their thinking is different than at normal